Now I want to bring in NBC News medical contributor, Dr. Vin Gupta. He's a pulmonologist and an associate professor at the University of Washington Medical School. Dr. Gupta, good morning to you. Good to see you.
Dr. Gupta, we just heard one of those powerful personal stories in Aaron's piece there. Cases are on the rise right now in 40 states. The total case count right now, 65,000 a day. That's the highest it's been since July. So what's going on? Why are we back in this place right now?
Good morning, Peter. Multiple considerations here. I think number one, we have to recognize that we're entering a dangerous phase with environmental considerations. COVID-19 and flu, that combination, they love colder, drier air. So that's number one. Viruses like this transmit themselves more easily. Number two, people are moving indoors. The CDC just issued guidelines about household gatherings being a real concern, especially with Halloween, Thanksgiving on the horizon, easy transmission amongst people that might not be sheltering in place together. And then number three, what we're noticing in Wisconsin, Iowa, places in Ohio, is that spikes in older individuals, the 60 to 69-year-old crowd, are usually lagging a spike in the 20 to 29-year-old crowd at college communities. We've seen this again in Wisconsin, 5,500 cases across 27 college communities preceding that large spike amongst the elderly community. So multiple reasons here, lots of reasons to be worried.
Dr. Gupta, as you say, we are entering cold and flu season, and it comes at a time when we're 7 months into this. A lot of Americans are experiencing pandemic fatigue. So what do people need to be doing to stay safe as we enter this new phase?
Kristen, it's a really vital question. And what I would say here is, as we enter the holiday season, first of all, urgent travel is the only type of travel anybody should be engaging with. But if you were to travel, if you are to engage in public, a 3-ply surgical mask is vital now. Cloth masks are good, and we note that they're protective, but that 3-ply surgical is key. That same type of mask the USPS was going to deliver to every U.S. household back in February, that's going to be really vital. Weekly testing, really key if you're going to be traveling. You want to travel. If you're going to travel, I'll say this, Kristen, for those who are going to embark on any type of holiday travel, you want to test yourself on the front end before you get on a flight, and then also on the back end. Once you reach your destination, quarantine for about 72 hours if you can. Make sure you're masking if you're engaging with other family members, and then test yourself again. That's functionally hard to do. And then I'll lastly say, we talk so much about mask mandates. Quality of mask care is key. We do not have enough high quality masks to deal with an airborne virus. What do I mean by that? Essential frontline workers having access to N95s. That is a lapse of government. When it comes to planning ahead, we need that.
All right. Dr. Vin Gupta, critical information as we head into the winter. Really appreciate it. Thank you.